These are three doctors who are expert in hypertriglyceridemia cases. Welcome to Dr. Anwari Amru, Dr. FATIN HUWAIDA, and Dr. AMIEROL LUQMAN. We will learn about the symptom factors, major difference between normal versus disorder people, treatment, and advice for you guys to stay happy and healthy. Assalamualaikum and hi everyone. I am Dr. Anwari. Have you been heard about hypertriglyceridemia? Hypertriglyceridemia is a state in which triglyceride levels are rise in the blood. It's often resulted by uncontrolled diabetes mellitus, lifestyle, and obesity. Overproduction of very low density lipoprotein or known as VLDS increase risk to get cardiovascular coronary diseases.
I would like to talk about the symptom. For hypertriglyceridemia, usually doesn't cause symptom until triglyceride level are greater than 1000 to 2000 milligram, which is why most people have asymptomatic hypertriglyceridemia. Above that level, due to excessive accumulation of triglyceride in the body, sign or symptom may include first, hepatosplenomegaly. Number 2 is lipemia retinitis. This can be observed as a creamy appearance within retinal blood vessel. Hypertriglyceridemia can also manifest as small papules on the skin known as xanthomas. With atherosclerosis, symptoms can include chest pain or shortness of breath, while acute pancreatitis symptoms like epigastric pain or nausea and vomiting can occur.
So, of course, we all want to prevent from getting this disorder right. But before that, we must know what's the common factor that can cause hypertriglyceridemia. Okay, there are a lot of factors that can cause hypertriglyceridemia. First of all, it is obesity. Obesity is defined as an abnormal or excessive fat accumulation that can present a risk to our health. How do we know a person is an obese or not? Basically, a person who is an obese have a body mass index (BMI) over 30. An obesity person we have tendency to get hypertriglyceridemia because the lipid abnormalities in the obesity person will elevate serum triglycerides, VLDL very low, density lipoprotein, apoprotein B, and non-HDL-C. So, patients that are obese will increase the risk of developing cardiovascular disease and therefore treatment will need for that. Okay, next, poorly control of diabetes, also one of the factors that can cause hypertriglyceridemia. This is because, as we know, diabetes is when our body cannot properly process food for use as an energy. So when a patient has diabetes, their body cannot make enough insulin or cannot use insulin it makes as well as it should. When our body does not have insulin, blood sugar will stay in our bloodstream. Over the time, it will cause health problems, include this hypertriglyceridemia. Last but not least, a person who has sedentary life also have high probability to get hypertriglyceridemia. What is sedentary life? Sedentary life is defined as inactive lifestyle. This type of person will always lying down, sitting and watching television and not doing any exercise. So how inactive lifestyle will affect our body? Okay, basically, when we not doing anything or we like in sedentary lifestyle, our body will burn only a low calories that will make our body will gain a lot of weight. As we can see, a person who have a lot of weight not doing any exercise, right? Besides that, our bone will get weaker and weaker and it will lose some mineral content. All of this will lead to our body to get hypertriglyceridemia. So that's all from me. We're going to the next topic.
Triglyceride can be synthesized from our diet, which are called exogenous triglyceride, while our liver can also synthesize from other molecules called endogenous triglyceride. After digestion of fats, monoglyceride and fatty acid will absorb into the intestinal mucosa cell. Inside of intestine mucosal cell, there are many like various lipoprotein and phospholipid to create cyclomicron, which is one of type of lipoprotein. Cyclomicron made up consists of free triglyceride, cholesterol, and lipoprotein. Cyclomicron is very small insoluble molecule that can travel to the lymphatic system and bloodstream to the muscle cell and adipose tissue. In capillary, cyclomicron interact with the lipoprotein lipase and apolipoprotein to act as cofactor, leading to the breakdown of the triglyceride core and releasing fatty acid into the adipocyte and skeletal muscle cells. The remnant cyclomicron, which high in cholesterol, degraded by acid hydrolysis in the liver to the produce free fatty acid, cholesterol, and amino acid. In liver, very low density lipid VLDL is one of the type of lipoprotein is produced. The fatty acid are synthesized from carbohydrate or released from adipose tissue. Then, the liver will export triglyceride in form of VLDL into the bloodstream to the muscle or adipose cell. VLDL are cleaved by lipoprotein lipase to form intermediate density lipoprotein ILDL. It's also called VLDL remnants. Next, IDL are further metabolized to low density lipoprotein and released to the bloodstream, which are taken by the lipoprotein receptor in the liver.
Okay guys, we meet again. So based on what Anwari have talked to you about normal person, I will describe you all about hypertriglyceridemia, so you all can compare both of them. Okay, basically hypertriglyceridemia is referring to an elevated level of triglycerides. So from here, we can see that the main difference between normal person and the hypertriglyceridemia patient is the level of triglyceride. Triglycerides actually required in the blood to serve as a source of energy. But when there is an excess, this will increase and it increase the risk of heart disease, stroke, and other heart issues. So here I will show you the difference between triglycerides level of a normal person and triglycerides level of hypertriglyceridemia patient. Besides that, there are two types of hypertriglyceridemia, which are the first one, primary hypertriglyceridemia, or we call it familial hypertriglyceridemia. And the second one is the secondary hypertriglyceridemia, or we call it acquired hypertriglyceridemia. This secondary hypertriglyceridemia basically are more common, and all factors that I mentioned before are for this secondary hypertriglyceridemia. Meanwhile, the primary hypertriglyceridemia occurs due to the genetic cause, such as mutation of the genes encoding a type of apolipoprotein. So, for your information, we have 4 types of hyperlipidemia, and 3 of them cause the hypertriglyceridemia. The 3 types of them is types 1, types 3, and types 4. The types 1 is familiar hyperchylomicronemia, and type 3 is familiar beta lipoproteinemia. And the last one is type 4, familiar hypertriglyceridemia. That's all for me. Thank you.
When it comes to treatment, hypertriglyceridemia may be improved with the help of diet, exercise, and alcohol reduction. But when those are not enough, medications such as fibrates or statins are required. Medication required when triglyceride level are above 886 mg.
Okay guys, so here is my advice towards you all, which is we, as a healthy human in this world, must always doing exercise. We must always do exercise in the morning, evening, so it will help our body always work smoothly. Okay, besides that, doing an exercise will lower the risk to get the diabetes. As we know, when doing an exercise, our body will use glucose to provide energy. So when this happens, the blood sugar in our bloodstream will always low. As I mentioned before, that diabetes is one of the factors that can cause hypertriglyceridemia disorder. So we need to prevent our body from getting it. Remember, a prevent way is always better than cure. That's all from me. Thank you. Bye.
Advice for you guys. Eating healthy is not losing the ability to eat your favorite food. We are recommended to eat our favorite food according to the food pyramid when we are setting up our meals to keep our body healthy from any diseases. Enjoy your food with healthy lifestyle. Thank you.
My advice for you guys is always stay healthy and be happy. Bye!